It was founded by the community for the community. Folks saw a real need that wasn't being met. There was service gaps, and the community really felt that it needed kind of its own niche organization. We changed the name from Haitian Women's Program to Diaspora Community Services, really to reflect the population that we serve. They were men, they were women, we had youth programming, and the folks that were really accessing services were from different racial and ethnic backgrounds. But I think over time, even over the 10 years that I've been here, it's still the issue of poverty and the need to reduce poverty. It's still the issue of lack of healthcare access. And so we launched our Medicaid Health Home program. And that is really an approach to looking at healthcare from a multidisciplinary approach. The communities that we serve disproportionately have high incidences of chronic illnesses. So from diabetes to high blood pressure, issues around substance abuse and mental health. And we also put HIV in there because HIV is now really a chronic illness. Those are the areas that we kind of focus in on and want to help people to better understand their care and access medical care to help them live better. So we want folks to be comfortable and to be able to say, I have this chronic illness, I need help, I need care, and that they can come to Diaspora to get the best services that they may need.
I first heard about Diaspora from a case manager at Brooklyn Hospital. I needed someone to talk to about women's HIV problems, so she sent me to Diaspora. I needed someone to talk to about things that were happening to me with the HIV and turning middle age and being a woman. They talk to me, they listen, and that's basically what I need so that I can put ideas that are in my head, I can say them out loud to somebody that can help me maybe to understand just what it is that I'm feeling. And those at Diaspora, they do that. So we need more programs like Diaspora. And I hope Diaspora is around a long time because women of our community really need places like this.
Despite whatever challenges you have, there is an opportunity to do well. And with support of organizations like Diaspora, folks can determine for themselves what their self-empowerment is about.
My name is Stephanie Frio, and I work with Diaspora Community Services as a program coordinator for their Medical Benefits Assistance Program. And we're located in downtown Brooklyn, and we have been serving our community now for over 30 years. The Medical Benefits Assistance Program helps provide access to health care for folks who are HIV positive and either uninsured or underinsured, and it's regardless of immigration status. New York is actually the epicenter of the HIV pandemic in the United States, particularly in racial and ethnic minority communities. So a program like this is very critical so that folks can have the access to the health care that they need in order to lead healthy lives.
My name is LaRonda Sharps. I am program coordinator of the STAR program, which is Safe Teens Acting Responsibly at Diaspora Community Services. Well, in the New York City area, a lot of programming and a lot of extracurricular activities in schools are being cut. So our young people sometimes have nowhere to go after school, and they will engage in some type of activity, whether it's positive or negative. So we try to be that positive reinforcement, that positive place that young people can come to when they need a place to just, do homework, if they need a quiet place because home is too loud, or if they need to learn skills that they probably aren't learning in school, like financial literacy or resume writing. We're a place that they can go to learn about these simple things that they need to know in order to be young, productive adults. We do have a core group of peer educators that we use to kind of be an extension of ourselves, who go out into the community and talk about reproductive health and positive youth development. We recruit those young people from our partner high schools. So these 15 young people are in those schools, and they're talking to their peers about sexual health, about the best ways to communicate in healthy relationships, and about what is the college process like? How do they get financial aid? Our young people are trained on all these things so that they can kind of be us in their schools when we're not there.
Me being in the diaspora and in the STAR program, it's something different. It's something different than what I really was used to, because I haven't seen all the stuff that I am seeing now, and I never knew all the stuff that I'm learning now. And people who's out in neighborhoods, who's out on the streets just hanging out and everything, they don't know the stuff that I know. But if they was to join the STAR program, they'll get to know.
New York, Brooklyn in particular, has one of the largest populations of Haitians living outside of Haiti. And so the organization wanted to have a commitment to Haiti. And so we decided to open a community health center that provides primary care. It's called the Centre Médico-Social de Port-au-Prince, so it's in the capital itself. All of the staff is Haitian staff. We recently launched a girls mentoring project that works with 30 girls to work on issues around violence and self-esteem and confidence, which really mirrors the work that we do here in New York, right? Working with girls around issues of adolescent pregnancy prevention and self-esteem and leadership. So it kind of crosses the borders, if you will, of trying to get the same message across, but just in a different setting. We say at Diaspora, we are the families we serve. I think that when funders look at us and support us, they do that because they see the work that we do, that it's consistent and that it's ongoing and that it's related to the needs of the community. We're not in existence just because. We're in existence because we know that the communities we serve have a host of different diverse needs. And that's our purpose, really, to try and empower the community as best we can.